Welcome back, everyone. My name is Suhaimi Ali, and I am the Director of Consumer Market Conduct Department of the Central Bank of Malaysia. And when I was first asked to be one of the co-hosts for this particular program, I was told that my co-host would be a beautiful lady from Russia. And this morning, I was introduced not to a Michelle, but to a Mikhail instead. And this is Mikhail, who would be with me throughout the event. And I would like to welcome him to Malaysia and welcome everyone to Malaysia and allow him to say a few words.
Yeah, thank you very much. And first of all, let me apologize for destroying your hope. I know it's always a pain, but you are welcome to Moscow, and we will do our best just to make you happy. Ladies and gentlemen, still good morning. Now we are coming to our agenda after so well-started Global Policy Forum. And I hope you all enjoyed the welcome remarks on behalf of Her Majesty and other respective representatives of policy sphere and Alfred Hanig. I would like to say just a couple of words regarding the Global Policy Forum agenda and Global Policy Forum goals. This year, that's the 5th Global Policy Forum, and you know that that's the biggest one, more than 400 participants, more than 100 countries. It means that AFI is growing and, let's say, topic of financial inclusion attracts more and more attention globally. What's from my point of view is very important that yesterday we spent the full day, the first time during the Global Policy Forum agendas, we spent the full day discussing transition to AFI independence and our capacity, how to make it stronger to reach ultimate goals of financial inclusion. And I'm especially happy to say, maybe some of you have heard about it, that in the last G20 leaders communique approved in St. Petersburg last week, we have a special recognition of importance of AFI independence. In particular, G20 leaders said that they welcome AFI movement to independence. And I believe that's really very good and great recognition of our efforts. Definitely it became possible because of AFI team and AFI family that we are all here. And I think that we should congratulate ourselves and pay special attention to efforts of core AFI team who does enormous efforts to make us stronger. So congratulations with that. And coming now to the global goals of our agenda for this Global Policy Forum, as we already discussed, we are going to consider financial inclusion through prisma of some, let's say, policy tracks. This is financial inclusion, this is integrity and stability, and financial literacy and consumer protection. And our goals, first of all, to see how all of these tracks are related to each other, because we definitely understand that we can reach the final goals of stable and robust financial system if even we take into consideration all of those aspects. The second, I believe, very important goal is trade-offs and how to avoid trade-offs, and we will talk a lot about it during our discussions for those 2 days. And the, let's say, long-term priority is definitely interaction with international standard-setting bodies. You know, my dream, I believe that AFI, once in the future, maybe not in the nearest future, but long-term future, AFI should become an international standard-setting body on financial inclusion. But before that, we definitely have a long way to go. But on this way, we will interact actively and more actively with existing international standard-setting bodies on different kind of recommendations, notes, and policies for better financial inclusion in very different areas. And of course, we will continue to discuss AFI independence, transition to AFI independence, because only once we are independent from the point of decision making, we can say for sure that AFI is for members only driven organization. Well, that's it. Now we are coming for discussion about the next session, and please take the lead.
Thank you, Mikhail. The earlier session that we had earlier discussed the interplay between various policy areas of inclusion, stability, integrity, and consumer protection. Now we are moving on to the session on the impact of financial inclusion on poverty alleviation and inclusive development. And this session will be moderated by Ms. Beatrice Moralanda, who is the AFI Associate. So I would like to invite her on stage. I would also like to invite other distinguished speakers to be on stage. There are Mr. Ronald Was, Deputy Governor Bank Indonesia, Ms. Maria Fernanda Trigo Alegre, Director General of Comisión Nacional Bancaria de Valores, Mr. Roger Voaris, Director of Financial Services for the Poor, Bill and Melinda Gates Foundation, and Ms. Aishwarya Ratan, Director of the Micro Savings and Payments Initiative, Innovations for Poverty Action. With that, I would like to hand over the session to Ms. Marulanda. The floor is yours.
Thank you very much. Well, good morning. I think we had already a fantastic morning with a great panelist session, the previous one. And I have the honor of moderating this next session, which really started and in the previous GPF 2012, when we already dealt with the issues, and it was called Making Financial Inclusion Real. There, you voted and you insisted that next GPF would deal especially on empirical results on how financial inclusion is working and how it has impact on economic development and on poverty reduction. We heard also yesterday, if you remember from your voting, when you were asked what you understood as by a policy-driven network. You all mentioned as the majority that you were seeking an evidence-based policy approach as a result of your involvement in AFI. And obviously, the theme for this GPF is precisely optimal impact. And that is what this session is about. I am honored to preside such an interesting panel. From one perspective, we have the regulators, starting with Governor Ronald Vaz from Bank of Indonesia, Maria Fernanda Trigo from CNBV from Mexico, and from the researcher side, we have Roger Furgis, Director of the Financial Services for Inclusion at the Gates Foundation, and Aishwarya Lakshmi from the Innovation for Poverty Action, one of the main research firms or think tanks doing research on impact. Where do we start? And I would just like to make that remark as an initial setting for this panel. We are starting, and we do all have a general perception, general evidence that financial inclusion has an impact on poverty. Today in the video, Bill Gates precisely reminded us of how this impact can occur, mainly by allowing lower income households to be more resilient to economic shocks, also helping them build assets. And the other side, more general research has shown us how economic growth is related to higher financial inclusion countries. Causality is still a question mark. So today we hope to help us get through finding if there is or not more evidence, empirical evidence, on how financial inclusion does impact, especially poverty reduction. That's why I would like to start asking regulators, how is your approach on providing evidence and data, and how do you go into the process of bringing into data into the activities and policy-making process that you undertake? And I don't know if you would like Maria Fernanda to start?
Ladies first.
Sure. Let me start by saying that data is the cornerstone of policymaking. It's fundamental and indispensable that we have data along the entire process of policymaking. First, for the assessment, we need the data to know what's the starting point to conduct a diagnostic. For example, in Mexico right now, we're defining our national policy for financial inclusion, and the biggest effort right now has been on doing a diagnostic, and so getting data of what's the starting point, where we are, what are the challenges. Next would be using data to prioritize what are the biggest issues that we have to address first. We have constrained resources, and therefore data is extremely useful to see where we want to put our emphasis and where we want to focus our policies to begin with and have the biggest impact according to the urgency of the topics. Next, data is basic for the formulation of our policies. And finally, and as equally important as the other steps, data is absolutely necessary to measure the impact. And that allows us policymakers to refine our policies, see what's working and what's not working, and to adjust our policies, our initiatives, our programs accordingly.
Governor,
Thank you, Beatrice. I would like to echo what Maria has said, that data is very important for policy making, and especially now when we are living in an information era where we all are aware that how data and information is important. And like in Bank Indonesia, all our policy should be based on research. And we call it a research-based policy. So I think there is no research going on without any data or information. So data and information is very important, because having data and information on hand, we can have our policy on the right track, and we can aim directly to which part of the people that we are going to address the policy to. Think that, Beatrice?
recognizing the importance of data, how does a regulator, and what is your experience in regulators bringing in data into the process, especially regarding financial inclusion? What are your sources? What are your challenges in finding this data?
Okay, there are many sources of information, I think, in the world. For our case, in Bank Indonesia case, in our country, we have the Central Bureau of Statistics. They can be the main source of data that we need for our policy making. We also have our branch offices spread out in our country. We have 42 branches around the countries. They can be also source of data. Because like in our case, we have every 3 months, we have a forum with the Board of Governors. We call it Regional Economic Study Forum, in which all the branch offices present the result of their study about the regional economy. And that can be a very useful source of data and information. Another thing is we also do our own survey. We have usually we work with third party to do survey on our economic data that we need for making policy.
What has been CMBV's
Experience.
experience in this?
Sure. Well, our sources of data depend on the type of data that we need. And so we sometimes need demand side, supply side data, impact assessment. At the CMBV, we have different sources. Mainly for the supply side data, we rely on all the regulatory reports that we in the CMBV produce. These are all the data that the banks have to report to the Commission by law. So that's usually our starting point. In other occasions, we've had to go out and collect the data ourselves. This is specific for the demand side. In Mexico, we didn't have an extended database that could give us an insight into what were the demand side information. And so we created the National Survey for Financial Inclusion, which was applied in Mexico last year, in 2012. And that has given us a tremendous insight into what are the demands, who are really using the services, are our policies for example, for banking agents, are they working or not? Additionally, we also rely on the work of researchers, specifically for data on assessment and evaluating the policies and what's working not only in Mexico but abroad. And that also feeds into our policymaking decision. I would also like to add that the most important thing about the use of data is that whether it's demand side or supply side data, there are three key characteristics of the data. One, it has to be timely. And that's one of the biggest challenges for collecting the data. If it's outdated, it's really no use. Also, it has to be accurate. And that's also one of the biggest challenges that we have. We also have a lot of the consumption of reviewing the data for policymaking is verifying the quality and whether the third characteristic, whether it's accurate or not. So I would say those are the biggest challenges, making sure that the data that goes into the policymaking process is timely, accurate, and complete.
Okay.
Sorry, Beatrice, I would like to add some more information because I haven't really answered your question in relation to the financial inclusion. We have a project under the Maya Declaration, which we call Financial Identity Number. This is a very important project for us because through this Financial Identity Number project, we try to give unique number for those all unbanked people in our countries. And I think through this, in the future, we can easily gather information as well. And now we are working on what we call Financial Inclusion Information System, FIIS. We have already worked on it, and we have already gathered data based on the FIN, Financial Identity Number, that we have given to those unbanked people. And for this project, we work very closely with the Ministry of Internal Affairs because they have what they call the national identity number for each of Indonesian people. So those two numbers, somewhere, somewhat, have to be related.
Okay. I find it interesting, the work that I find many regulators and central bankers are undertaking, or superintendency of banks, bringing in information mainly and normally from the supply side. Now, Fernanda talks about this effort on doing a demand survey. And that's what researchers normally do. They go to the demand side and try to find out what's happening. And how are the final beneficiaries of financial inclusion understanding their inclusive process? And I would like to then ask the Gates Foundation, and Roger, you as a representative, I understand when the foundation decided to go into financial inclusion services, where data was so scarce, where impact was not so evidence-based, you have undertaken a big job on doing research. And I would like you to tell people here what are the main findings and what was the process of doing that research and the main findings you're coming out initially from that research.
Yeah, thanks, Beatrice, and thanks for having us here. We're really excited about the developments within AFI and where the organization is going, obviously. I think we as a foundation really look for where there are big leverage points to affect large numbers of people who are excluded. And if you look at the area of financial inclusion, of the 2.6 billion people who live on less than $2 a day, somewhere around 77% are left out of even a basic bank account. And if you go down into sub-Saharan Africa, that number can rise to 85%. And that's really quoted out of the Global Findex, which many of you use. Well, 5 years ago, that number didn't exist. We had great guests what we thought the exclusion rate were. There were studies that said half the world was unbanked that McKinsey and others did. But there was really no reliable source of data, either on the supply side or on the demand side. And when Bill and Melinda and the foundation began to look at the space, they asked themselves a series of 3 questions, which is, first of all, why does it even matter? Why do we care about this exclusion problem? Secondly, why is the market not taking care of itself? And third, what would have to change in the underlying economics in order to make large-scale inclusion possible? And so our drive around research is really to do a couple things. One is to provide policymakers with public goods around information that help them make better decisions, that maybe a country can't fund itself, maybe they don't have the capacity, or maybe there's cross-border issues where a philanthropic organization can leverage that. And those are probably issues like the Global Findex, where I mentioned earlier, to find out what are the actual numbers of inclusion, what kinds of services are poor people using, or something that we started in a number of countries recently around geospatial mapping of financial access points. And the governor of Bangladesh actually mentioned it in the last session. Why is that really powerful? Well, it's powerful because if you're going to reach into poor communities, you've got to figure out who's excluded. And it's amazing how hard it is to figure out where poor people live. And we all know it anecdotally, but to actually do it in a systematic way where a governor of a policymaker or a minister of finance could say, this is the place that's left out. This is how economically I'm going to reach those places. That's a really hard thing to do. And what we've seen is we've done that work and we've launched the findings of that. Well, we'll do that soon in Bangladesh, but we've done that in Nigeria and Tanzania and Uganda. What we find from that is it really shows you who's excluded and what would need to happen in order to bring those people in. Then we ask ourselves, beyond the public good, why do we care, as I said earlier? And the point that comes out is we care because, as Bill said this morning, poor people are actually rising and falling by the hundreds of millions over the years out of poverty, but they're pushed back in by shocks. And if we can help people through financial services buffer themselves against those shocks, we keep them from falling back in. And that's where a lot of the work we've done with IPA and others around what is the research that says why financial services matter. And if we go around even to the branch areas, there was a study done in India, I believe a few years ago, that just having a branch in a community raised the number of the lending that went into agriculture, had a GDP effect on that local community, and actually lowered the level of poverty in there. Or we did another large-scale study in Kenya where we looked at people who were embedded in the M-Pesa mobile money system and how they absorbed those shocks. And what we found really clearly was that people who were embedded in the M-Pesa system actually absorbed shocks better than those who were left out. And even 6 months later, I believe there was a continued depreciation or continued impact of up to 10% in household expenditure because of the shock they experienced. And yet those that were embedded in M-Pesa didn't even have any decrease in the disposable income. Now, the power of that is we have 2 kinds of information. We have both an impact information that we think is transferable across countries, but then from that, we also have a public good information around access points. Because the other key piece of that study was that the closer you were to an agent, the closer you were to an access point, not only the speed at which you receive funds increased, which had an effect at the household level, but also the amount of money that you actually received and how quickly you could use it. So we're engaged in research both from a public good point of view, but also from a behavioral impact point of view.
Very interesting. Now that you mentioned precisely the difference between just having information is a public good vis-a-vis understanding what impact the services are providing, I think it's time that we could put up the first question that we have for you, and if you would get hold of your voting instruments, we would like to ask you over there a basic question, which is impact
here.
data really available today, nowadays, in your, that I don't see. Don't forget about that. Is impact data really available in each of your countries?
The polling is very simple. All you need to do is to press the button that represents your answer, and that's all you need to do.
I think this one was easy
So we have
enough.
90 seconds for you to key in your answer. This is quite simple.
And we can have a short session. Maybe the results are ready? Okay. Do you think we're ready? Well, this is not surprising. For me, it took a long time to understand the difference between having information and having impact evaluations. And I think we have here one of the persons that has represents one of the institutions that has done most of the impact evaluations in many fields, one of them being financial inclusion. So I would ask you, Ashraya, first to define very briefly what is the difference on having results data vis-a-vis impact data. What would you say is the main difference, and why is it so important to have both?
Sure, sounds good. It's a pleasure to be here and to be able to discuss these topics with so many people who make important decisions. So it's a pleasure on my side. So I think I'll throw out two sort of pieces of information and then say a little bit on why these are important in thinking about just a regular survey and data collected on households and what distinguishes it from something like an impact evaluation that is rigorous. So I think one distinction that we should keep in mind when thinking about what is it that we're looking for in terms of outcomes is distinguishing between financial outcomes and welfare outcomes. Financial outcomes, and so keep that sort of on one side, and on the other side, think about data that is collected administratively and data that reflects what's going on in a household, for example, or within an enterprise. So those two distinctions, I think, are important to keep in mind. A lot of times, we can use administrative data, which banks collect, which all sorts of providers collect as part of their routine operations, to make certain claims, to make, go through a certain set of analysis and make certain claims. But if we wanted to know what was going on in terms of household welfare indicators, you often need to have time to figure out what's going on with household members, and that usually requires large-scale surveys, which often drive up the cost of these exercises. So to distinguish between what's just a regular survey that tabulates what's going on in a population and what's an impact evaluation. Specifically, the kind of evaluations that we do follow a methodology that's very close to what you see with medical trials. So lots of names for them, but you can think of them as randomized controlled trials. RCTs is the short form. But here, exactly as you would think about testing a new medication, it's a pretty high stakes exercise. You want to make sure that the risks are minimized and the gains are maximized for the average person in the population. And you also want to know how is it affecting different people differently. But for this, you need to engage with a couple of problems that have dogged microeconomics for decades, which are there are two issues. When I, supposing, give you the medicine and I don't give you the medicine, and I compare at the end of 2 years what happened to the health of this group and this group, well, when I started off, there were systematic differences between those who were getting the medicine and those who were not. So at the end, when I make my conclusion, I'm mixing up the effect of the medicine and the effect of your individual characteristics. It could be that more people in this group to start with exercised more, and more people in this group slept later. So then what I'm concluding is that the medicine plus those who exercised more had a better impact than the other group. So it's very important to distinguish what is the impact just of this medicine, right? And the other issue is, as we're running sort of this evaluation, everything's changing in the world, right? So there are all sorts of shocks, all sorts of changes in the economy, at the household level, in society. How do we distinguish, again, what's the impact of this intervention and this particular intervention compared to everything else? And so one way to do it, as in a medical trial, is to take a sample from the population you're interested in, flip a coin for every person in the sample. And whoever gets heads will be given the medicine. Whoever gets tails will be given the placebo, which is meant to have no effect. And so when you do this in a large enough sample, statistically, you will have two groups that are equivalent. Those who get heads and those who get tails, on average, will have the same distribution of characteristics which are not statistically distinguishable. And then when you provide one group with the treatment and the other one with a placebo, at the end of a certain period of time when you measure their outcomes, what you're looking at is purely the effect of the intervention. Because for both these two groups, they're going to go through the same shocks on average. For both these two groups, it's the same distribution of baseline characteristics. So then you have a much more robust measurement of impact.
When you hear the description of an RCT, I find it absolutely amazing that the way you do it and the way you're able to do it. But I start finding difficulties understanding the time frame of a regulator and a policymaker and a time frame of an RCT, which at the end will show us if there was an impact or not. I would just like to leave that question and that question in my back of my mind and go back to the general view from the foundation. You have been putting a lot of resources, and I suppose by now you have some results. You have done and you have financed many RCTs. What would you be able to share with this audience on what are you finding are the main results coming out of this research?
So it's hard to summarize in just a few moments, and you saw some of them put up on the board in the slide recently. I think a few things stand out to us. One is that the poor, like everybody else, suffer from some of the same self-control habits that we all have. And one of the studies that was shown on the board a few minutes ago actually was done in the bank I started in Malawi, where they looked at commitment savings accounts for smallholder farmers. Now, we all know that smallholder farmers are some of the hardest people to get impact around. And there are yet 600 million of the 2.6 billion people that live on less than $2 a day. And what the study found is that by actually having a commitment account whereby farmers had set aside money that would end up being used for fertilizer and other kinds of soil nutrition or enhanced productivity, if I remember the numbers right, actually increased overall land production by about 10%. They had 22 to 24% increase in harvest, and that was a 17% increase in disposable income. Well, those are big effects for smallholder farmers. And the reason why we think that kind of approach is really powerful, because we think those results are generalizable. It doesn't show that smallholder farmers in Malawi, where the study was done, are different than smallholder farmers in the rest of the world. It shows that they suffer from the same kind of self-control biases the rest of us do. And we have other kinds of information that support that, right? Which in my country where I'm from are called 401ks, retirement accounts. The fact that my retirement money comes out of my paycheck before I even see it, I'm much more likely to save. And if you think about the implication of that, if I had to carry around a whole year's worth of salary in my pocket, none of us would be very good at it. I barely make it home with money from the ATM, right? And so all of those claims, by building in results that help people in self-control and behavior, probably drives usage, probably drives access, and develops the kind of patterns that have real household level impact that we care about. Because the difference in 17% disposable income to smallholder farmers, that's the difference, as we all know, between a dirt floor and being able to afford a concrete floor, a thatched roof and being able to afford a tin roof. And if we can get those gains to be sustainable over time, that is real impact in helping people absorb the shocks that they face. And so we care about RCTs because of their generalizability. And we're willing to put up with some time frame, as you pointed out, because we hope they're rigorous enough that we can say that's something that's generalizable. Now, how do we figure out how to scale that? How do we figure out that gets into the private and the public sector? And how do we make sure that when we do that, it gets the welfare effects that we're looking for?
I think that's a great introduction and a great understanding, precisely because of the results being generalizable. The importance of the results that IPI has been gathering. And I think then I would like to lead you then to show us some of these results, which can be used not only in each country or in each experiment, but which we should be able to use and show precisely as impact results from financial inclusion. So could you share some of these findings?
Sure, happy to. I'd like to add a note, though, to what Roger said in terms of these specific examples and how they translate into something that is generalizable. And part of what we do is we totally recognize that every experiment is constrained by its local environment. But as you know, the Gates Foundation supports our work on replicating promising results. So that's this, after you innovate and evaluate one particular instance, you'll know which one is looking really promising. And then we go about replicating it in multiple diverse sort of contexts to see what's the range now of results. And then we say this is absolutely amazing how consistent the results are. We should be scaling this across locations. And commitment savings is exactly one of those beautiful examples where the results have been positive in many locations because of this underlying problem of temptation that we all face in different forms. I thought maybe I can quickly provide you with one expected result and one unexpected result. And then I encourage you to look at, there might be a handout that you have which has about 8 studies findings summarized for people to quickly flip through. So one expected, let's talk a little bit about one of the pain points or barriers to financial inclusion, cost. So fees. We've done a couple of experiments on what happens if you lower just the first point of entry into the financial system. Remove the opening fees, which are quite formidable in many countries, about $7, I think, in the 2 locations we were looking at, in Kenya and in Nepal. And just removing the opening fees and encouraging people to open a very basic, simple, no-frills savings account. In the Nepal study, and this was in a semi-urban area in the slums, cash assets over the course of the year grew by 50% in the treatment group, and total assets by 16%. So this is astounding. And if you look at the Kenya example, this was one of the first RCTs conducted on savings access, giving access to savings account, simple savings account, which actually had a negative interest rate, effectively, because of inflation plus the withdrawal costs. So it's very tough to see why anybody would put money in this account. But providing this very basic savings account access to micro-entrepreneurs in a rural area led to something like a 37 to 58% increase in daily business investment for the women vendors who were involved. And this is, again, this was a small study, and now we're replicating it to see, does this stand? Because if this is true, even if you think about the literature and the impact sort of evaluation results coming out of microcredit, which is, oftentimes associated most closely with, micro-enterprise development, right? That's supposed to be the goal. But these results would actually put the microcredit impact evaluation results to shame, if this is true, that micro-entrepreneurs are so savings constrained for a variety of reasons that having a way to safely put aside a little bit of money every day actually allows them to build up their own capital in a very promising and effective way. So I'll give you one unexpected result, because this is expected. We all are believers in lower fees because it will improve access, usage, and some of this asset creation. So an unexpected result comes from something you think will do good. So this was an experiment in Kenya in which they randomized the availability of ATM cards provided either to the male head of household who owns a single account, female head of household who has an individual account, or to accounts jointly held by husband and wife. Yeah, ATM card access. Now the ATM card reduces your withdrawal fees by about half in the Kenyan context, and they waive the fee for getting the ATM card. So much greater accessibility to a transaction point. As anticipated, for those who had joint accounts and those who were the male holders of an account in a household, you have savings activity increased by something like 40%, and a commensurate, I think, 16% or so increase in balances. Because if it's easier for me to get it out, I'm happier to put more in, because I know I can get it out when I need it. But because of the way it was designed as an evaluation, because of the baseline data collection around behavioral characteristics and social dynamics within the household, we found that for women holders of accounts, there was a neutral effect on average, and for women holders of accounts who at baseline low bargaining power compared to their spouse. At baseline, before the intervention, they actually use their accounts less when they were given an ATM card. This we would never have expected if you looked at an aggregate statistic. But this points to a really interesting and emerging area of research around household dynamics, kin dynamics. Finance is a very social activity. There's a lot of bargaining that needs to go on, as we all know, within our households to make an investment decision, to make a consumption decision. And oftentimes it seems when women have a certain bargaining issue, sometimes having a more restricted account, a more commitment-like account with higher fees helps them bargain better, to say the money is locked away, I can't touch it, But when it becomes more easily accessible, maybe that leverage is not possible. So I'll leave it at that, and we can talk more as we go along.
Beatrice, if I can just add one more thing. We heard in the earlier session today about the iterative nature that policy is going to have to go to as we think about reaching inclusion. I happen to be in Seattle with a large number of people from the high-tech industry who include organizations like Amazon and others. They are now taking on this sort of experimental approach to their own product development and delivery, and using real-time data that we've heard from policymakers as a struggle to conduct many experiments again and again to develop an iterative process to reaching out to get increased usage of whatever product or service they're trying to sell. Now the power of that for us as the Gates Foundation is if we look around at low-income people, we know a lot about agronomy, we know a lot about vaccine, we know very little about the financial behavior of poor people. So how do we get in the data flow and run the kind of fast experimentation that allows for safe, secure, robust policy development that reflects the best data out there and doesn't have to wait for a long time to come up with those results. And so I think there is something we can learn, and there is something that resupports this iterative nature that needs to go on.
Thinking of that dilemma that I find, and I often find in regulators saying we need to put policies out there. We're pressured to put, and we have to show results rapidly. I find that this investment that the foundation has been doing in public information and public research is very interesting and can be used. But I would like to hear from the regulators. How do you find then you can complement your data efforts, typical data efforts on access points, accounts, etc., with this type of research that's coming out from the RCTs and from efforts done by examples like the Gates Foundation? How do you how can you use that data? How does it help you then? And then ask you to directly pose questions to both of the representatives of researchers.
Sure. So the results of these types of studies are key for regulators and policymakers to be able to refine our policies. Like you were saying, we're pressured to put out policies, we're resource constrained, and sometimes we don't have the ability to do these long-term studies. Additionally, I think one of the greatest benefits is that the Gates Foundation, for example, and other researchers do international research. So it's not necessarily something that we're already doing in Mexico. Maybe Peru is doing something that we can learn from. And that's just a tremendous benefit for us in Mexico and for other policymakers to be able to copy and adjust what's working, what it's evidence-based that's working. For us in Mexico, we recently were sitting down with the World Bank and trying to work together on an RTC they want to do on financial education. And one of the biggest challenges we had, and I would like to know your experience, how you've dealt with this, because you already mentioned some of the challenges, timely, this takes time, and you have to design the studies. But as we were working with the World Bank to try and define how we're going to do this RTC on financial education program, we as regulators have a social cost of doing these studies. Because you need similar groups, and you have to decide what community is a control group and what community you actually give the benefit. And given that some of the regions in Mexico are very different, for example, we're thinking about going into Oaxaca and testing a soap opera to teach financial education. And it's really hard to give it to one community and not to another one, because they'll communicate very easily. They trade among themselves, and often we find ourselves in trouble, because one community will raise in arms why the government is doing a policy to benefit this community and not this other community. And that often happens to us. It's one of our biggest concerns. And how do you deal with those social issues that arise from this type of studies?
Would you like to answer? Then we'll give the word.
Sure, I'm happy to go for the second. I'm happy to go for the question that you posed on how do you decide and what are the ethics and the politics of running a randomized control trial. So I'd say one of the approaches which is typically the case for nonprofits, maybe not so for the central bank, but for nonprofits or banks or other smaller players, is there is an implicit budget constraint. When you're starting a new program, you want to roll it out, but you don't have enough to do it everywhere at the same time. So then the design is to allow for a phase-in approach. Start in some communities, and in those communities, you randomize who gets it first. And then over a year, then you expand to new communities. So eventually, everybody gets the program. But what you have built in is this randomized rollout, which means you can actually rigorously measure impact. And I'd also say one consideration to keep in mind is certainly there are some costs in deciding where it goes first and how do you manage that. But I think I always reflect on this being, there is a greater moral imperative to do what is right. And I think development policy for decades has gone about doing things without enough of a basis, and I think there are it's good to be cautious to do the right program and maybe do it a little more deliberately.
Would you like to comment on that, Roger?
I think no. I think we had a great answer there. I think we would also say that not all of our research needs to be RCT, that there's a variety of standards and approaches that we take as the foundation, both on the supply and the demand side. And one of the things that we've been doing a lot of, we spent the last year working with McKinsey & Company on a large-scale payment study to say, okay, payments matter because we need usage matters, as we've heard. And if we need to get usage, how do we change the economics? And so we'll be, I think, launched today, the output of that study that looked at over 100-person interviews and deep dives into 30 countries to say what drives payments. And that's completely about the supply side and not the demand side, and has a different kind of standard of care than the RCTs that face.
Thank you very much. Governor Max, what
Thank you.
would you like to discuss about this?
Yeah, thank you, Beatrice. I think the researcher and policymakers should always work together, because even though that we have our own departments or directorates who do the research. But it's like a big puzzle, jigsaw puzzle. We always find that there is something missing there. And the result from the outside researcher is always something that we can put in. So we can have a big picture about what the policy should be addressed for. But I have a question to our researchers, because Indonesia is such a big country. We have so many culture inside. And when we talk about financial inclusion, even we deal with the world, with many different countries. How do you think, based on your research, where do culture is in this big initiative which is going on? Do you always put culture as one of the factors that you look at when you do the research?
I'm happy to take a first cut. That's a very interesting and complicated question. But there are,
Sorry.
but maybe there are two ways to try and approach it. So one is within a particular experiment, you have randomized in a certain population, right? So there, between the treatment and the control group, cultural characteristics are on average equivalent and are taken care of. So then again, what you're looking at is the impact of the intervention. So that's, I think, we can safely say it might influence, but it influence both groups sort of somewhat proportionally. But now, how do I take this to another part of Indonesia, another part of India? So here, I think the key thing is, one point to make is we should absolutely replicate before scaling. There is no excuse for just saying it's going to work anywhere else. But the way these experiments are designed, and this is something to keep in mind in looking for a good experiment, a good RCT and a not so good RCT, is what is it testing? A good randomized trial will be testing an underlying mechanism or theory. There will be well anticipated results on why a particular intervention will work better than another one. And usually that's because of some underlying mechanism that you're testing. The example that Roger gave on self-control issues or time inconsistency, which is a problem a lot of people face across cultures, which is the problem of I want to do something in the future, but the steps that I need to take to get there, I evaluate those differently. So I want to send my child to school, but right now, if you showed me if I saw a poster for a movie, I'm tempted to spend the next 20 rupees on the movie rather than, even though my goal is to get to the education. So some of these behavioral tendencies, and there is very good academic literature out now, they are somewhat consistent across cultures. Or the social dynamics. Everybody in the room sort of nodded with me when we talked about intra-household bargaining, because it's true across cultures in different forms. So the idea is to test the mechanism and then adapt the product or intervention for every context. But if the mechanism tested is nicely correlated with the intervention, you'll have a very powerful intervention to scale.
Well, I think the audience has many questions that we would like to give them time to address to the speakers. I would like to then, before that, put up the second question we had for you, the audience. And if we can see it, we would like to know, from your point of view, what is the biggest challenge facing financial inclusion impact measurement in each of your countries? So you find funding, lack of technical expertise, lack of a clear measurement strategy, and lack of perceived value. Could you vote, please?
I was going to ask this question to you about the impact.
Wow.
Measurement strategy, lack of technical expertise, funding. Okay. Very interesting. And regarding these results, I would like just to make a last question so you discuss between each other is how does this amount of public investment information already available there? How can we make it easier available for policymakers? How do we interchange all this information that's going on, all these regulators and policymakers trying to do their best efforts? Should we facilitate and communicate better? And what are your ideas, each of you, from each of your sides, on your perspectives, what are your ideas on that topic? Do you want Maria Fernanda to start?
Sure, I'll start. I think basic is communication, being open to work together. At least in Mexico, we have a very close relationship with the Gates Foundation, other institutions, World Bank, and many other researchers who are interested, even with academics inside in Mexico. The Commission has a very open policy. We like to public our information. We have open door policy. We often receive all these initiatives. What we try to do, for example, is we have programs with the universities where they can have access to our data. And that way, we're very often resource constrained to do some of these analysis. And that way, through working together with the universities, we can exploit that data that we have available. And so specifically on financial inclusion, we designed the survey and we made it publicly available as soon as the results were ready. Well, we're always glad to work with researchers and designing, like I was mentioning, we're working with the World Bank right now, designing an RCT. And I guess the best way to work together is just communication, hearing what they know, their knowledge, their experience, and for them to hear what is our context, where we're coming from, what are our policy constraints and even political and social constraints within the country so that the impacts and the results can be better applied.
Deputy Governor?
Thank you, Beatrice. I think I agree with Maria that the communication plays a very important role here because without any communication, I think those results of the researcher and policy cannot be publicly announced. But there is one thing that's very important to create a good communication, which is transparency. Yesterday we discussed about transparency when we discussed about independent AFI, and I think it is something that should be base of the communication. And this is especially, I'm talking about the central bank. Usually, central bank is a very close institution. And nowadays, I think we have to shift our paradigm, that we have to be more open to all our stakeholders, the public, the researcher, and other institutions in the government, things like that, because without that, the communication would not happen. Thank you.
Asharya, your point of view. I'm seeing you agree with them.
Absolutely. I think the first requirement of signing up to do a rigorous evaluation is you should be able to live with the results. So I think that's what stops most people, even though they would not say it, is because it's harsh when you do a really, sort of somebody else is doing the evaluation in a very rigorous fashion, and that's one of the conditions is we need to be honest to the research. All those who are doing these are academics in renowned universities who have to publish as per, publish the results in full honesty. So in that sense, it is a little bit of saying I'm willing to be honest and transparent, and I think that it's a win-win for everybody once that decision and that leadership is established. I think another sort of way maybe to make this easier is one of the roles that IPA and JPAL play as these agencies that run these trials and bring the results to practitioners and policymakers is we know that as practitioners and those in policy, you have very little time. And all of our results are buried in at least 30 to 40 page academic papers with a lot of jargon. So it's very difficult to take the time to actually see what the results are. So we're moving in the direction of better communication ourselves and often through like written stuff. So even this very brief, two-pager that you have, it only lists a one-line result, which is a complete disservice to 3 years of a study. But we know that you want the punchline. So here's the punchline, and then there's a footnote which will show you the paper if you want to know more about the details, right? And so in that sense, I think stepping up on those efforts would also be very useful.
Roger, your point of view.
Yeah, I mean, we're not researchers by nature, right? We're interested in research because these are really big problems to solve. And if we're going to solve them, we got to solve them with new business models, new technology, and innovation. And that's not something we do really well as bankers or even as central bankers, right? We sort of go incrementally from what we've known before. But I think the data's out there. We're not going to actually reach the 77% of people who are left out unless we're going to be innovative. And how do we know what innovations work, what don't, so we don't waste public money? How do we know what the household welfare effect is so that we don't have the unintended consequences that I think we heard highlighted in the previous section today, earlier today? And then how do we know how we best use our policy tools in order to drive the outcomes that we want? And so what we would argue is that part of it is about dissemination, and we're getting better at it. We have FSP maps, we have Findex that gives this data publicly. But part of it is about you as policymakers saying, it's not just a matter of trying harder. It's not just a matter of believing stronger. It's not a matter of intensity, but it's a matter of new real innovation and how we change the way we approach things. Because we're going to have to cut the costs. We're going to have to figure out new ways to reach down into poor communities. We're going to have to figure out how payments get safe and secure to low-income people who don't have a big branch to protect that payment. And doing that, well, that's going to take data and research that now is beginning to be publicly available. So I challenge all of us in the room to not just think how it gets out there publicly, but how we consume it, digest it, and then make it culturally appropriate to where we're having to put these policies into place.
Well, I think that was a great presentation. I would like to give the audience the possibility of addressing questions directly to the panelists. So I would like to know if there are any hands up.
I think the topic of this originally in the agenda was the financial inclusion impact on poverty alleviation and inclusive development. And as often happens in discussions on research, the research questions are pieces, smaller pieces of that, because you can't, it's difficult to design a research around that. So what we get is a discussion about things that may or may not be correlated to poverty alleviation and inclusive development, but are well researched. So I guess my question here is there evidence that financial inclusion does lead to poverty alleviation and inclusive development? If so, what is it? And if not, how would we get that?
Sure, thank you for the question. And maybe, I think because it's also a time-limited exercise, how about I'll cite maybe a couple of results that I think are bang and center poverty alleviation. So a commitment savings product that was offered in Kenya to ROSCAs, so savings groups, and again, as an RCT, led to, in one iteration, 66 to 75% more spent on preventative healthcare. So that's a healthcare, on bed nets, et cetera, which has repercussions for malaria incidence and low health. And another instance, when it was accompanied by a social component in the group, it led to over 120% increase in healthcare spending by the household. The agriculture example is, again, bang and center poverty alleviation. 10% more land sown, 27% greater agricultural output, output, and 17% increase in expenditure, in household expenditure. I think another one, which I mentioned earlier, was in Kenya. Investing in a basic savings account led to a 38 to 56% increase in daily business investment, and it has a 30% increase, over 30% increase in consumption of these households. So those are, and so in economics, consumption is the equivalent of poverty alleviation. So maybe that helps, investment and consumption, yeah? So,
Larry, I'll go out on a limb, right, to the AFI group. I think if we pull the RCT work, if we pull the experience in part of other countries, I think a few things come out. One, that we said earlier, poor people have the same behavioral constraints about time-boundedness, about commitments that we all do. And so I can say pretty confidently, savings matters, and we've got to get up the tools that help them save easier than they do today. And I think that is, we're going to go out there. So savings really does matter. The second thing we'd stay out is that insurance looks like it's starting to matter. And there's a great study that's out in Ghana that showed that providing weather insurance, I think, increased 13% in the amount of resources people put into that land. So insurance matters, de-risking people matters, right? I think that that holds up pretty well. I think in addition, if you take the demand side and the supply side information together, and not all of this is RCT level, I think that proximity matters. You've got to get financial services to reach where people live. I think that they've got to actually be used. So no-frills accounts that no one uses, that has no impact. And so how do we get usage up? That's the big piece. What I would tell you I think shows up is that price matters, right? The poor are really price sensitive. And that doesn't mean the marginal price. That means the nominal price of what they have to pay. So cheap onboarding and cheap transactions, that makes a big difference to low-income people. And I think the final thing, what we said, is they need a full suite of financial services because their lives is as complex as the rest of us. So then the big question is, on the demand side, what are the economics of providers that are going to get us there? And who organically are the best ones to benefit from that? And how do we think of new kinds of partnerships that leverage that?
Yeah, thank you. I want to thank you for the conversation. That's a very rich conversation. My concern is the quality and integrity of data. And this is particularly with respect to baseline surveys. And in communities, most communities you'll find in developing countries, the issue of primary data and records are not there, particularly when you are doing a baseline survey. And for you to have appropriate policy that can come out from any baseline survey, you really have to have integrity of data. So what are the most appropriate approach, measures to determine which the best way to go in data generation?
Sure. I'm happy to give a first cut. So the way IPA and JPAL do data collection is exactly to address that concern. So we have extremely high confidence in the data. And a couple of examples of how you would go about doing ongoing verification is, for example, I think our back check rate is about 10%. So this is your audit rate. It's redundant data, which means you do your baseline survey, and then whoever's managing this exercise randomly picks 10% of all surveys. So when you're talking about thousands of households, it's a big cost. 10% of these surveys to have somebody else independently go and collect the same data. So then you're able to see how valid is it, the data. Did somebody miss up, or is it actually true? Another point is, after data collection from the field at the point of data entry, we often have double data entry, even if it's redundant. And the more and that's because when two people are entering it, you'll see where somebody made a mistake much more easily. Now we're moving a little bit more towards electronic data collection, and there you can have a lot of smart steps built into the survey, the electronic survey, so it can stop you when certain data don't match up, so you actually have to go and ask the household member to verify. So there are lots of good strategies to ensure high quality data, and I'm happy to speak with you after. These are some.
Well, I think we have, oh, sorry, another question?
Gracias. Más que una pregunta, quisiera contarles un poco cómo hemos logrado en Ecuador disminuir los niveles de pobreza en 6 años. Hemos logrado disminuir en 11 puntos la pobreza extrema, hemos disminuido en 8 puntos. Pero, ¿cuáles son las medidas que hemos tomado? Como señalaba la investigadora, bueno, las metodologías de evaluación de impacto son las que conocemos todos, tienen que ser rígidas, partir de una línea de base, tener grupos de control, son metodologías conocidas por todos, pero creemos nosotros en Ecuador, por lo menos así lo visualizamos, que la inclusión financiera no es suficiente. Hay que habilitar a las personas económicamente, hay que incentivar el ahorro, Hay que ese ahorro que logran les permite apalancar créditos, les permite esa inclusión financiera. Además, hemos tomado medidas de manera que las condiciones financieras para ese acceso al crédito sean adecuadas a sus condiciones, es decir, creando mecanismos como garantías apalancadas en la demanda pública, en el mercado público. Hemos determinado por ley una reserva de mercado, de manera que lo que demanda el sector público sea prioritariamente adquirido a las poblaciones pobres organizadas, producen juntos, generan escalas, se posicionan en los mercados y esto permite, además con capacitación y asistencia técnica, que puedan vender productos de calidad al sector público. Como un apalancamiento, después se van desarrollando, hacemos un acompañamiento mínimo de 1 año, van desarrollando sus productos, haciéndolos de mejor calidad, cada vez más competitivos y se insertan también en el mercado privado. Pero son estas condiciones, ya termino, son estas condiciones que, es decir, la inclusión económica permite esa inclusión financiera y permite además una inclusión social. Todo esto junto permite la movilidad social, es decir, la salida de la pobreza o de la extrema pobreza.
Okay, thank you very much. Anybody else? You panelists want to? Well,
I can
sorry.
maybe just very briefly respond.
One final question.
Thank you to the presenters. Mine is not a question, it's a comment on the whole issue of whether financial inclusion leads to poverty reduction and inclusive development. I think while we are justified in pondering that question and interrogating this subject matter, I thought it may be right to comment that that question arises partly also because we are patronizing the poor. That's why we can afford to ask that question. I'm thinking of myself, supposing someone comes to me and says, should you have a bank account? Does it reduce your poverty? I have a bank account. And do we really think that we should close our bank accounts because they don't contribute to increasing our salaries or our incomes or what? So to take just a utilitarian approach to the question it's to me an infringement also on rights. People need bank accounts, they need financial inclusion because it's dignifying, it's good for human dignity in certain senses of thinking about it. So I think we have to look at both sides. Because we have to finance these things, they must be cost effective, they must yield results. But let's not forget that we all need bank accounts. No one had to prove that I have to have a bank account in order to have it.
Thank you very much. I think that was a very interesting last remark. I would thank you all. Thank you especially the panelists. I think it was an introduction, and what I find the most interesting part is this is work in development. I think the biggest news is that researchers are there. There are funders that want to be willing to invest in this public information, and that we still have a lot to do in exchanging information so that you all can build on more better inclusive policies to promote poverty reduction anyhow. Thank you very much.
Thank you, speakers. For those attending Leaders' Lunch, please proceed to level 3 to the executive dining room now. And before we break for lunch, for others, I have short announcements to make. One is the fact that member zone training is open during lunch from now until 2:15. The session will be in English and the location is Computer Training Room Level 1. Lunch will be served at Sasana Cafe, which is 1 floor up, so you basically just need to take the escalator up. We will resume at 2:15 today for the breakout sessions. So this year we are having 3 different breakout sessions on 3 different policy tracks. The breakout session on financial inclusion will take place in the auditorium. Conference Hall 1, which is one floor up as well, will be the venue of the breakout session on financial stability and integrity, and the session on consumer protection and education will take place here at 2:15. We would also like to encourage you to find some time to visit the exhibits that we have around this area. And also, because we have received a number of requests from participants about our mobile link service, which is a bus that goes to rural areas to promote financial inclusion, the bus is available to be visited outside the main lobby. So, and for those who are registered to join the optional study visit this Friday, please collect your ticket at the registration desk from now until 6 p.m. tomorrow. So enjoy your lunch and please be back in the breakout sessions at 2:15. Thank you. Good to see you. Hi. The I think it should be slightly more than half a day visit because you are going out of town actually. So it's pretty far. So I'll be able to get a midnight flight. You should be fine. You should be fine.
This other group, where are we supposed to meet?
Which one?
The one on the economics of
The first one,
economics of
the financial inclusion.
do you have your
Oh, the full schedule. Well, basically, when you look at the schedule, this is conference hall 2, conference hall 1 is upstairs, and the auditorium is where we had our session this morning.
no. I mean, it's just a matter of clarifying which one. This one.
This would be auditorium. Yeah,
That one. Where?
the one earlier. Yeah.
You were mentioning, where's the leaders' lunch with the leaders
Level
with
three.
the standard setting bodies?
Level 3. Yeah.
Thank you.
This one. Conference hall 1 is this one.
Upstairs. This is conference hall 2.